Welcome, everyone. Today, I have a special guest. Dr. Susan Fox is an expert in helping women and couples enjoy a healthy pregnancy, whether through IVF or natural conception. In her 23 years working with patients and clients, she combines traditional medicine with latest research to improve nutrition, circulation, sleep restoration, and emotional stress relief. To make her work accessible, she designed the Your Fertile Health Program at Health University. Please visit healthuniversity.com to learn more, including DIY, acupoints, stimulation, guided meditations, and Qigong exercises for the 5 phases of the 4-week menstrual cycle. Dr. Susan is committed to changing the conversation of infertility, currently 1 in 5, and to show that healthy moms make healthy babies, which make healthy families, communities, and the future. Thank you for joining me. I was recently on your show, so I really appreciate you making time to be on mine, and so we can talk about fertility across all of my different, I guess, people who, I think it's funny how many people silently stalk me, but we'll take advantage of the stalkers and let them know that they have a place. So for my patients, we've talked about this ad nauseum about fertility and how it can be affected by inflammation, especially chronic inflammation. So maybe, I think you have a great statement. I'll let you put that forth to start this, and then we can carry on the conversation.
Great. Well, thank you. Thank you so much for having me. And yes, I so enjoyed having you on my podcast, Health University. And I think the listening audience has an interest, at least a percentage has an interest in what we're both having to say. And much of what we have to say is similar. So my claim is that you don't want to get pregnant. And when I say that to someone, they usually go back on their heels, look at me askance, and want to run out of the room until I say, what you want is a healthy baby, because you can have as many positive pregnancy tests as the cows come home. But if you are struggling carrying that pregnancy, delivering a healthy baby, having a healthy postpartum, enhancing your healthy family and community and future, then you've missed the mark. And so we need to start before you try to conceive.
Right.
Yep. Right. Because we see.
That's where I was going with that. I was like, I want you to highlight how to start doing this, because much like my book writes about, or in the book I wrote, it's about prepping, not reacting to surgery. Because if you react to surgery, you're constantly behind. And we can, obviously, you're going to talk about the same thing. That's why it's easy for us to chat, because preparing is 9/10 of the battle in this situation. So
Absolutely. Absolutely. And in reading your book, I love your book, the Smart Protocol. And in reading it, I was like, well, this is exactly what I say to folks. We need at least 120 days, the folliculogenesis timeframe within which an egg goes from its primordial pool and begins being influenced by its environment to ovulation and conception. And if we're missing that important window, well, then that egg is potentially swimming in a toxic pool of inflammatory markers, getting the genetic impression of genes that are a little bit askance, whether it be from mom or dad. And so we want to make sure that we're doing everything we can to reduce that toxic load, reduce that inflammatory cascade, and clean up the follicular fluid so the egg can grow healthfully.
So what are the top things in terms of what you see in your clients, from whether it's history or testing, or what you perceive to be the things that are, from a toxin perspective, contributing the most to what you see in terms of issues with conception that you want to try to clean up in that 3 to 6 months prior to ever even trying, basically?
Yeah, that's a really good question, because I live in the San Francisco Bay Area, where everyone prides themselves on being, really healthy and clean eaters and doing all the right things. And in many ways they are. So I don't mean to, to fault or point a finger, but there are also things that they're not doing. So for instance, they may be getting up in the morning and chugging back that cup of coffee before they get on Zoom for 10 hours. Then they're running to their high intensity interval training or their Pilates or yoga class. Then they're going out for that glass of wine with friends. And then they're staying up late at night because they've got work to catch up on, and then getting to bed at, whatever, midnight, 1 o'clock in the morning with all the blue lights, that are sort of affecting their ability to detoxify and remodel and restore at night.
Not blue backgrounds, just blue light. So
Blue light.
I have a blue background today.
No,
So,
no, just blue light, just blue light. The light that has us think it's high noon when it's actually 10 p.m. So I just go through, and many they're drinking fluids, they're not hydrating. So we just go through some of the basics, and that's the irony, is that it isn't hard. Well, let me put it this way. It's simple. And in some cases, making these lifestyle changes are hard. So if I tell someone, how much water are you getting a day? And they say, well, I get plenty of tea. And I say, well, that's not water. So what about filling up 3 liters of water each day and just giving yourself a visual cue? Have I gotten through 1 by noon, 1 by 2 or 3, 1 by 6 or 7? You don't want to be chugging at 11 o'clock at night and then peeing all night.
did you feel like when you have those interviews and you're talking to people, do you think it's because you mentioned tea, and I always think of like, okay, I'm on the kind of Dr. Lustig sugar, issues. Sugar is so addictive that from a, obviously the high fructose corn syrup, all the stuff. So I drink a lot of black coffee. I don't mind drinking, tea. I just don't put anything in it. So it's one of those things where people just look at me like I'm very like, well, how can you do all that? And
Oh, yeah.
do you think it's a sugar craving? Is that what you see a lot of?
I think it is in some cases a sugar craving that they're masking with their creamer, their oat milk creamer in their lattes. And I really don't have a problem with caffeine. I think that caffeine can be very useful when it's taken at certain times in the day. I personally love my ritual coffee, and I don't mean the name ritual, it's my ritual of having coffee, but I want to make sure that I'm having that around, I don't know, 9 o'clock in the morning, not when I first open my eyes. I'm going to start with water to rehydrate. So I think it's a matter of again, that push, and this may be a reaction to our local environment where everybody is, on the high tech side of things, or being very busy. They really take some undue pride in how busy they are, and so they keep being that gerbil on the wheel. So as I say, we just go through some of the basics, and they remember that, like, yeah, this is how I would feed my child. So maybe this is how I should feed myself in my anticipation of having a child.
Right. I mean, it's interesting where we see a lot of people immediately go to caffeine first thing, and if you crave it, I mean, part of the things, you have to give your adenosine receptors a chance to reset, because
Mhm.
basically, we'll just say about 90 minutes. I think, you're being kind, 9 a.m. It just, so a lot of people get up and then they're right to coffee instead of, to your point, hydrating. So maybe I, underlying to everything philosophically, we talk about independently with our patients. We're talking about making tiny behavioral changes that then
That's
will
right.
add up to, in your point of view, you're trying to get the correct environment or the healthiest environment to conceive, unless I'm missing the point.
Nope,
Uh,
that is the point. Uh-huh.
right. So, um, you know, uh, I think that's we'll say the quiet part out loud. The hardest thing to change is behaviors.
Absolutely.
That's
Exactly right. Exactly right.
100%. So she's trying to get you to change your morning behaviors and your nighttime behaviors, and then I guess everything in between.
Modify. We'll say modify. Maybe that's an easier word to hear than change, because really, again, a lot of what everyone is doing is spot on. I would say, you mentioned labs. I do use labs in my private practice, and I make available labs for people, who are doing my courses across state lines, so that we can see, are there markers that need some attention? Is their vitamin D low? Are their thyroid antibodies high? That kind of thing. and we'll make recommendations and adjustments accordingly. But for the most part, if we can make these fundamental changes, I mean, I can't tell you how often people who are getting ready for IVF get pregnant because they've made these changes. They've had to go through some kind of, maybe a mold detox, or maybe they had, some kind of, medical event or procedure that they want to make sure before they go into IVF that they're ready. And the body wants to heal itself and wants to do what it's being asked to do, but it just needs the right support. So that my point was I kind of went on a tangent. Not everybody needs Vitex. Not everybody needs vitamin D. Most do. So it's a matter of, finding out what you need, supplementing there, using food as medicine so that you're not chugging back a handful of supplements while you're, I don't know, having the same kale salad you've had for the last 5 days. These are ways in which we can just modify our day-to-day activity to really re-engage with the health that our bodies want to have.
Yeah, I think each of us, faces this problem with inflammation, and
Mhm.
we are trying to create just more awareness both through our courses and our books and our shows that, everybody faces inflammation. You and I both face inflammation. How you choose to, take it on essentially is a function of your personal genetics, your environment, how you eat, how you drink, the air you breathe, how you sleep. And certainly for women in general, certainly I'm sure you're going to touch on this, the things that are put on your skin through skincare, um, dare I say, are dangerous, meaning that
Mhm.
if you're not
Mhm.
super careful with your products, you're going to get paraben exposures, you're going to get all sorts of chemicals that you don't want that could ultimately, there's a very delicate balance in a woman's endocrine system to begin with. And when
Mhm.
you're trying to conceive everything that you can do to put it, in better balance, that's all I ever talk about anyways, just trying to get better balance about anything. Um, it'll be in your favor. And I'm sure you talk to your patients about what they put on their skin, and obviously all the other
Absolutely.
things with food, et cetera, like you just mentioned. But I find products to be a very slippery slope.
Well, they can be, again, because we've just been so enculturated to think that we need, I don't know, 10, especially women, 10 products, to before we go out the door. We have to wash our face, we have to put the toner on, we have to put the cream on, then we put the makeup on. And each of these can be riddled with hundreds of chemicals that are going directly to our eyes, at our nose, at our mouth. We whatever toothpaste or floss or whatever you're using. You don't want to be you don't want to be flossing your teeth with petroleum laced thread so that it can glide more easily. You don't want to be using a toothpaste that has sort of, all of these additives and chemicals that are going right into that very thin mucosa of your mouth directly into your bloodstream. And so then don't even have the pass at the liver for trying to clean it up. So absolutely, it is not just what we eat. But I will say about what we eat, because I'm afraid I might forget, try just pesticide free, organic. It doesn't, you don't have to go to the farmer's market each day. Lots of stores now have organic, frozen foods, frozen vegetables and fruits. So go for that, and go for the, wild caught, free range, grass fed, grass finished, organic, flesh proteins as well. You don't need to eat as much. So the cost isn't as prohibitive as it might appear when you look at the price per pound in order to get your nutrients. Again, we've been supersizing for so long. We think we need to eat, a porterhouse steak in order to get the right dosage of protein. And that's not necessarily true. And I say this about the pesticides and the foods because I was interviewing a colleague for a summit that I'm putting on called Best Prep for Pregnancy. It'll come out in January. And he shared a study that showed umbilical cord blood having 4 times the toxic load than mother's bloodstream, which this baby is, it doesn't even have barriers yet and is being then exposed to 4 times the amount of toxic load. So take as much of the toxins as you can take away, the better off you'll be. And again, you don't just want to be pregnant, you want a healthy baby.
Yeah, I was gonna say I'm a bit more rigid about it, I would say.
Mm,
I think if you give folks too much leeway, they're not going to understand exactly what you want. So for surgery, I mean, I will be, um, clear about, how I discuss it so that there's no confusion. So
mhm,
the the food aspect. So I get people probably, I just had a patient last week, in fact, that comes to mind, a very, what you would see physically outside in looks like a healthy person in terms of like body weight and physical characteristics. However, if you ask them or interview them about how they feel, what they can do, all the signs and symptoms of a pretty advanced chronic inflammatory state,
mhm.
muscle and joint pain, fatigue, brain fog, problems with their arms and legs, with different types of neurologic
Yeah.
symptoms that can be, shocky pain, it can be vibratory symptoms. And those are all very disconcerting to someone, you know. And when someone in their 30s tell me, I swear they say this all the time, they're like, I just thought it was a function of getting old. I'm like, look, you have no idea what old is. 55 personally, and
66 personally.
very well know what nerve pain is.
Mhm.
So, when you say those things, we should never have uh, women of childbearing age in that kind of situation. And that's purely, a function of, I look at personal genetics. I was going to, ask you about methylation. How many people you see have problems with fertility based on MTHFR and other methylation
Mhm.
pathway issues, as well as problems with VDR and vitamin D synthesis and absorption, et cetera. But when I get those, I just listen to them and I'm like, okay, this is clearly somebody who doesn't genetically detox well. And then we always use it's very cliche to use the bucket analogy. Like you can only do so much when your bucket's full and overflows, you become more symptomatic, which is, I think it's a very simple analogy when you think of it.
Yeah, and accurate. Yeah.
And then, to your point, now I'm pretty rigid about food.
Mhm.
So it costs a lot to eat well, but it costs a lot more to care for yourself when you don't eat well.
Mm.
So the wild caught fish, the non hormone fed, non antibiotic given,
Yeah.
animal proteins, and I don't discriminate about anybody's diet. I really don't care as long as you're getting enough protein in your diet.
Right.
I kind of
Mhm.
one thing that I don't compromise on. So if you're vegan or vegetarian, we use a pea-based protein in our programs
Mhm.
to accommodate that. But whether it's a performance issue as it relates to stamina or cognitive issue, focus, all of that boils down to like what you absorb, your liver's ability to detox things, which is obviously a genetic trait. I say you can't pick your parents and you can't outrun a bad diet. So if you can't, work on those things, you're going to have principally a very difficult time. And, maybe if you look at people who don't methylate well, do you see a lot of that where they already have some baseline issues? About 40% of the population doesn't methylate well. So,
I just presume that they're not, right? But if they're coming in my door, something's amiss, and really, it give by the time they're in their early 30s, then methylation is likely, methylation detoxification is likely a component, if not the very thing. So in terms of their supplementation, of course, I require a request. But I think I require that they use, a methylated folic acid and MTHFR, folic acid, so they can actually use it. Because once again, this is a person who really needs to make sure that her folate is adequate, not high levels of folic acid that she can't use, needs to make sure that her clotting mechanisms are actually not going, kind of aberrant and off the rails, because obviously then she will not be able to hold her pregnancy. So yes, I not, it's not just the liver, obviously, and I'm sure that you would concur, it's the gut. And because, that's, they're working in symphony with each other. How well is your microbiome helping to support the excretion of these once used need to get out hormones?
Yeah, I'll put it out there. I find a lot of people have, and we already, just like you're making a assumption that they don't methylate well. Pretty much everybody comes to my door doesn't. So
Yeah.
that's our line is purposefully all methylated. We don't have the non-methylated B.
Yeah.
And absorption, to your point, is the under. I find it interesting that so many companies create so many supplements, and there's always the next, best thing.
Mhm.
And the problem is, if you think about it, there's no one test that I or you or anybody can provide to look at absorption.
Right.
So you have no idea what somebody can do at the brush border, which is the microscopic level where everything gets absorbed. And so whether it's the, fad of collagen, which is somewhat interesting to me, or supplementation, which culturally a pill shot drug, what can you give me right now to solve this problem,
That's,
is
yeah.
is the ideology or the psychology of the like, what can I have right now? Just give it to me
Right.
right now and I'll take it. And you know I literally had a patient in my office after surgery tell me they gave themselves a shot in the butt. And I said, what? You gave yourself a shot in the butt of what? She's like, I don't know, my naturopath gave it to me. And I'm like, oh, okay.
I hope it was
So for
just B12.
everybody listening, that's not okay to do.
Right.
And
Including the naturopathic doctors. That's not okay to do. Do not send your patients home with a loaded syringe.
number one, if you want to give a patient of mine something that I operate on, you had better damn well tell me in
Mhm.
advance before you ever give it to a patient. So
Mhm.
that all gets cleared with me. So,
Mhm.
one, I was like a little bit baffled that somebody who spends the time and effort to come visit me in Austin and have surgery would do that without even talking to me.
Yeah.
So I let them know that's not okay.
Yeah.
Ooh, and for everybody listen, the reason is it could potentiate bleeding. So I
Mhm.
never know uh, who's going to have a problem with that. But I take and apply 28 years of experience to avoiding that problem. So I don't have any unregulated supplements. I don't have any unregulated herbs. And certainly nobody gives themselves injections without talking to me of a non-prescription, strength, medication or homeopathic remedy, just because it all then falls on our shoulders to, react to whatever's going on. So
Right.
it was an interesting
To
thing.
react to the reaction, the potential reaction. Yeah,
Uh,
absolutely.
it
Wow.
was
That
just
is stunning. That
It
is
was
stunning.
funny. I was just like, I hardly ever get shocked about anything, but I found that to be shocking. One, that they would do it, and two, they would not know what's in it.
Yeah. Yeah.
They just took it for granted that it was okay because it came from their naturopath.
Yeah.
And I
Oh,
obviously everybody has good intentions. They're trying to help. And
mhm.
this had been something probably that they'd used or recommended for their patients for other surgical procedures. However, uh, none of that's okay with me.
Right. Right.
So,
To your point, I mean, I actually want to really just amplify that in saying that in my practice, if someone's going through IVF, I am working with that IVF doc. I know pretty much what, because we've been in relationship for 23 years, what gets removed prior to, egg retrieval time, again, to reduce the risk of bleeding, so that they're not wondering who's out there, what in the world making recommendations to this patient, because yes, it falls on the surgeon and the surgical team to then deal with the ramifications should something be in this patient's, system that they're unaware of. So yes, listening audience, please listen to Dr. Rob on this.
yeah, because you don't know what combination of things and I don't want to get too deep in the weeds, but if it's a combination of things that can cause your platelets not to work properly, then it potentiates a situation that can cause bleeding. So I'm super careful with and don't stop supplementation around the time of surgery. And I'm one of the few people that does it, but I have control of what we're doing and it's
Mhm.
balanced in a certain way. So I don't feel uncomfortable with doing it, but you're trying
Mhm.
to eliminate. So for everybody listening, uh, I've spent the last, several years balancing out how we do supplements prior to and after surgeries so we don't get into situations with too many antioxidants, which potentiate bleeding. But most of the dogma is you got to stop everything 2 weeks before and then resume afterwards. The reason is your platelets need that time to recover if you've been taking a lot of high dose or multiple antioxidants, which we don't do because we understand what's going on, and we want our patients to get the nutrients. So mine are mostly liquid based. So when you put them in your mouth, you absorb them. And this patient I was describing, who, was a young person who's got chronic inflammation, they don't feel well, they have all these symptoms. And I said, do you have problems with smelling like cigarette smoke or chemical odors? And they're like, oh, yeah.
Mhm.
And so those are people who clearly have problems with glutathione utilization in their livers. And so I was like, okay, we're just going to do a little experiment here for you so you understand what I mean about this, so you believe what I'm talking about.
Yeah.
So I've been taking my oral liposomal glutathione for years now. So I just give myself a huge spray of it. And I say, this stuff tastes kind of like a citrusy, flavor. And if you're experiencing problems, it'll become kind of sharp and bitter tasting, relatively quickly because it's liposomal. You get it on absorption. And I said, just, try a little spray. And usually people get a little overconfident and they'll take a big spray. And I was like, that's not going to go well. So I have water and, a little mint,
Uh-huh.
because that's going to combine and, as you know, detoxify in their mouth. So basically, that's what their body craves. That's what they need, because now their toxin burden is so high, their liver can't accommodate anyway. So it is a I don't use it all the time anymore, but this was just such a shining example
A
of what was
parlor game.
it's going to be like a thing to really help that person understand.
Yes.
And it's not and for me, listen, it's not a trick. This is what your body craves. It's not
Exactly.
I'm not doing anything weird.
Right.
Just a function of toxicity and what your body tries to do to get rid of those things in combination. And she's like, it becomes a bitter, sharp, taste. And she's like, oh my gosh. I'm like, yeah, I mean, that's why you don't feel well. Your liver, to your point, in concert with your GI tract, doesn't work well. So your liver is trying to do its job, and all the testing does not establish functionality like I was taught.
Mhm.
For your liver to start failing from a blood test perspective, you're pretty far down the road of liver health.
Yeah.
And it's not going to be a good road, right?
Right.
So those
Right.
things,
Right.
what we're talking about, you're not going to see on a blood test. You're not
Right.
going to see elevation in what's
In
called
enzymes. Yeah. Yeah.
transaminases, AST,
That
ALT.
that ship has sailed. Yes. Mm-hmm.
Yeah.
Mm-hmm.
So when you see those things, I mean, you got lots of problems.
Yeah.
So your liver is a huge organ, and it's very efficient in dealing with things. But when it's reached a certain amount of burden, like I'm describing, it'll struggle.
Yeah. And so that people aren't left disheartened, the liver can recover and can rebuild and remodel. So don't despair and presume that all is lost. Get started now. And people say, well, when do I start? I'm like, now. Whether or not you're trying to conceive this month or whether or not you've got 3 months or 6 months. If in my perfect world, you'd have 6 months. But if you don't, if people are coming to me and they've already met with their reproductive endocrinologist and they're underway, I say, well, let's, start now. I mean, because yes, we've missed some time, but we haven't missed all the time. Again, if you want to have a healthy baby, you can start reducing the toxic load now, and the body will have this incremental, exponential recovery throughout pregnancy.
Right. And then habitually, I should go through, I'm obviously older now, and our kids are 19 and 16, and we see people with younger kids, and all
Mhm.
the things that, I think, we can all kind of reflect and say, oh, we would have done this slightly differently. My wife worked really hard to always make sure our kids, had quality, food and liquids and everything. But obviously we look back and we're like, oh, we could have did this differently
Oh,
or that
definitely.
differently. And we didn't know that our daughter was had gluten sensitivity, non-celiac gluten sensitivity. So most of us, I would say, secondary to the modification of grain, certainly have developed this non-celiac gluten sensitivity. So
Absolutely.
I don't have celiac disease, but I definitely am sensitive to gluten. And if I have gluten, there's going to be lots of problems with me, and my daughter's worse. So she
Mhm.
doesn't have celiac disease, but she has an extreme problem with processing, gluten. So we made that switch, I think, about 8 years ago is
Uh-huh.
made it.
Yeah, I mean, we didn't. I would say the same, Dr. Abu. When I was, my daughter's 33, rolling into 33, and I did the best with what I had in terms of my knowledge base at the time. But I can recall thinking that I was being the best mom in the world by giving her a glass of soy milk with her with her lunch or whatever. And now it makes my stomach turn to think that how much of this product that I encouraged her to consume. We stayed away from the jelly beans, but she had carrot juice until she practically turned orange. So
Yeah.
yeah.
I think, that's probably a good segue into how we think about this now. And, I was at a 50th, I've been at two 50th birthday parties in the last few days, which is
Hmm.
interesting. I'm now considered an elder, I guess, plus 50, you're an elder.
Yes.
Below that,
Yes.
you're not.
Yep.
So I was trying to
Plus
think
65, you're a senior.
what I offer, to one of them. And I think probably the biggest changes are what we're talking about. Like you have to take serious your air quality. So get
Hmm.
a freestanding air filter. Don't consider that your HVAC in your home is adequate because it's not. I'll just say that now.
Right.
And there's different types of filters. The Jasper.co company and the Swiss IQ Air company, and there's others. You just have to line them up, see what fits you, fits your budget, fits your household, fits where you live, and that's one thing you can do.
Hmm.
Uh, Two, please don't drink out of plastic.
Oh my goodness.
So don't reheat in plastic and don't drink out of plastic. And I'll just
Don't have plastic, period, to
the
whatever
thing
extent you can.
still baffle me is somebody will travel from out of the country or out of Texas to visit us, and spend time with us for about a week is usually, the time frame here. And they'll come in from traveling. It's hard when you travel. Um, you got to be really careful and I'll focus on women because that's predominantly my client base and yours as
Mhm.
well,
Yeah.
is phthalates are extreme hormone disruptors. So if you're trying to get pregnant or if you're trying to get prepared for surgery, you need more balance, less disruption. So phthalates, which are what are in plastics to make them firmer, those leach into the water, or when you reheat something, they'll leach into the food, however you want to think about it. So we
Mhm.
don't want those. So just like you said, avoid plastics and don't drink out of plastic. So, get stainless glass, something like that. I know it's harder to
Mhm.
travel, but figure it out. I don't.
Well, although, in most airports now that you bring your water bottle, you bring your stainless water bottle, and there are areas to just fill it up once you've gotten through your TSA check. So it's less hard than once was. And to your point, I think we just have to relearn how we go about our activities of daily living because it's just habit that has us think that we need to swing by the newspaper shop or the coffee shop at the airport and grab that plastic water bottle because we think we need to rehydrate. And you're not rehydrating, you're just filling yourself with plastics, with
It's really
phthalates.
hard. The airline industry won't like this or the airports, but I don't drink anything at an airport and I don't
Mm-hmm.
eat anything at an airport.
Mm-hmm. Mm-hmm.
One, because the food quality at an airport is frightening. So
Mm-hmm.
for everybody listening, like, so when you get to food, like I'm a big, I eat a lot of protein. So that's,
Mm-hmm.
so, wild caught fish or the appropriately raised type of poultry with no hormones and free range and grass-fed, grass-finished, meats if you're going to eat meat. Obviously, and fat is not a bad thing. Healthy fats are actually very good for
Healthy
you.
fats are imperative in my field. Hormones need the fat in order to transport, but they need healthy fats.
But everybody's been told they should have a low-fat diet. So,
Well,
honestly, we haven't talked about insulin resistance and what a problem that is. But if you just had enough healthy fat in your diet and healthy protein in your diet, you probably would actually not, or you would convert a type 2 situation, which is adult onset diabetes, or what we were taught, to a insulin situation where you're not resistant,
right.
anymore. And then, we haven't talked about it, so we'll talk about it as we kind of wrap this up. Is I prioritize sleep above all else. So if somebody asks me what behavior modification you can do, is you don't need to drink 3 liters of water a day, and you certainly don't need to do it before you go to bed. So I have
Right.
people, control and time up things on a 3-2-1. And shout out to my friend Reagan for instilling this in me. He made me think about it more. I did it, but I didn't do it as crisply as I need to. So for just a rule of thumb, I tell people to stop eating 3 hours before bed, stop drinking 2 hours before bed, and then an hour before bed, get off your random devices. And where you're going to sleep has to be a little bit cooler, quiet, without light. So whatever you have to do to make that environment, you need to work on that yourself. And so when somebody tells me, because I always ask these questions and people don't like them, like, well, how long can you sleep uninterrupted? And they'll tell, or I'm like, well, and if they start hemming and hawing, I'm like, do you get up to go to the bathroom? And they're like, oh yeah, a couple times. I'm like, all right. So if you're a woman and you get up to go to the bathroom, that's like I'm 55. That's like an advanced male with benign.
BPH, right?
That's not normal.
Right.
And you can address this. You should not, under any circumstances, be getting up in the middle of the night to go to pee as a woman of, we'll just say, childbearing age. That makes no sense to me. You need to see a urologist to make sure there's not a problem if, in fact, after you adjust your fluid intake, that
Yes,
percent.
exactly. Yeah.
So, that's a very simple thing. And people tell me they get all this great sleep. So the ways that you have to prove this to me is you have to have a wearable, like an ultra-human ring or a Whoop strap or something that monitors your sleep, or 8 sleep or something. So, don't tell me you have a clean diet. Don't tell me you have great sleep without proving it, because without proof, without data, there is none of that. There's just talk. And it would help us both probably if we had a little bit more to go on. And I'll let you chime in now, because those are my basic things that I have to have.
Yeah. So yes, to your point, my advice is to, finish your liquids by 6 or 7 p.m. Because I will even go so far as to say, according to the Chinese medicine clock, what time you are beginning your sleep matters. So I am recommending in bed by 10 or 10:30 so that you're asleep by 11, and then will sleep through to 7 to get your 8 hours of sleep. Because again, in that Chinese medicine clock, those are the hours where our organs of detoxification are most active, right? And it just makes sense. So yes, definitely finish your fluids so that you're not creating a problem where you're going to have to likely void during the night and wake yourself up. Many of my patients in private practice will use an Oura ring, or will use, because it will sync with their cycle cycle app, where they're trying to also keep track of their levels of hormones. And then some don't use the data, and I'm a little bit more I guess I would say forgiving with that, because I'm actually seeing data in terms of their hormonal pathways. So if they don't have a ring and don't want to have a ring or a watch, I'm less inclined to be as adamant as you are. But here again, what we're trying to do is similar but different, right? I mean, you're putting someone through a surgical procedure, and your data, it needs to be collected and carefully analyzed prior to and following. Mine can be a little bit more organic, for lack of a better term, especially if someone is not trying to, going into an IVF cycle. if they're going into an IVF cycle, I really try to get a little bit more adamant about let's see your data. Let's see how well you're doing. So that's a long-winded way of saying not a whole lot.
Oh, it's a long, arduous process, and recovery from surgery is not easy if you
Right.
have alignment and all these other, processes we're talking about. And it's
Yeah.
always easy to take for granted all of the things we're talking about because they're behavior modification.
Yeah.
And it's not a pill shot drug. It's, I have to change this habit in order to get this outcome, which is
Mhm.
always, the most complicated thing for anyone to actually, you know, process and actually
Mhm.
execute is a behavior modification. So on that,
Yeah.
I would like to thank you for joining my show. Do you have any, please let everybody know how to follow your program and get in touch with you so that they can learn more about your options for helping them.
Yes, great. Thank you. It was really a delight to chat with you. And thank you, audience, for listening in. So you can reach me through my website, healthuniversity.co, C-O, not .com, within which there is the Your Fertile Health program that will help you, really DIY yourself into better health and better prep for either your IVF or natural conception outcomes. I do have a podcast as well. It's called Health University, spelled Y-O-U University. A little play on words there. And then I can be reached through, the regular socials. The handles are at Dr. Susan Fox Insta, at Health University YouTube. Pretty easy to find me. So really happy to, help anybody who needs to get a bit of support, because I really, really, really want to convey that this pandemic, if you will, of infertility affecting 1 in 5 women, I believe, or people, I believe is a misnomer. It is subfertility based upon our lifestyles, and we can reverse it. And again, don't want to just get pregnant. You want a healthy baby, healthy family, healthy community, healthy future. Really, the buck stops here. It's really on us now.
Awesome. Thanks for coming on.
Thank you very much, Dr. Rob. My pleasure.